The Spanish flu was the last major pandemic that we saw aggressively test health systems and around the globe. We have ventilators and the capacity to intubate patients in such a way that we can significantly manage the complications of a disease like this. And we also have the capacity to more effectively sanitize and hygienically treat people in hospital spaces. And I think we also have the capacity to respond more effectively as individuals because of our generally higher levels and capacity for hygiene, to wash our hands. We have access to clean water. All of these things that make it easier to sanitize the spaces that we live in and protect ourselves from COVID-19. After World War I, health systems were already shattered. People were weakened and compromised in general as a result of years of one of the most disastrous wars humanity's ever known. And as a result of people traveling back and forth from war zones to their home, or refugees traveling back to their homelands, you had a lot of movement of people who were able to carry the disease more effectively than you might have outside of the context of war. A lot of our strategies today would look very similar to those that took place during the Spanish flu, i.e. social distancing practices, refraining from going to large events, no shaking hands, frequent hand washing. All of this would look very similar to the sort of responses that were strongly encouraged in 1918, 1919. The comparisons to the Spanish flu and COVID-19 should make us realize the potential severity of this epidemic. If people lack access to healthcare, if people lack access to services as a result of this epidemic, then, obviously it's very much a moment where we need to stand up, take notice, and take care of this pressing health concern.